Okay, so we'll get started. Whoever comes in could just join from where we are. But welcome everybody. Thank you so much for being part of our very first webinar. My name is Farian. I'm a recent UConn graduate and the founding youth partner of Be a Part. Super excited to kick this webinar off with you guys this afternoon. Basically, today we're here to answer one really important question together. How can we keep our most vulnerable communities safe? Be a Part is a youth-driven campaign that unites scientists, young leaders, and local advocates to rebuild healthy and resilient communities in the face of COVID-19, starting in Connecticut. Here at Be a Part, our main goal is to provide education, support, and hope so young people could help their community through volunteerism and activism safely. A big part of that includes making sure that everybody, especially our most vulnerable community members, are protected. So how exactly can we protect our most vulnerable communities? My co-host Lexi, a fellow Be a Part youth partner, who's a senior at the New School studying psychology and public health, can explain a little bit of our thought process behind this panel. Lexi, if you want to jump in.
Yeah, thank you so much. I would love to explain the thought process behind the panel. So basically, early on, it was kind of thought that COVID-19 was going to be this equalizer of sorts, something that would impact all of us equally, regardless of our race, our class, our gender, or our age. After all, viruses don't discriminate, right? Well, now we know that this is not the case. Months into the pandemic, there is a ton of data that shows that COVID-19 disproportionately impacts Black and Hispanic people compared to their white peers. More men are dying from COVID-19 than women, and older people are much more likely to suffer the severe impacts and possibly death from COVID-19 than younger people. And at the same time that all of this is happening, months into the pandemic, as we continue to suffer as a result of COVID-19, a month has passed since the murder of George Floyd sparked protests across the country for racial justice. And the issue of racism is not isolated to criminal justice. What we found is that racial disparities exist in so many different issues, ranging from climate change to health and healthcare, as we'll talk about today. And COVID-19 has really just exacerbated a lot of the effects of the pre-existing inequalities that we know exist. So how we address these disparities right now, in this moment, during this pandemic, will determine how safe we're able to keep our communities. And we as young people are in a very unique position to make change here. And we really want to harness that. So as the Connecticut community continues to suffer as a result of racial inequality, this webinar seeks to bring 4 voices from the state together for a conversation on what's going on and what we can do from here. And now Farian will introduce our wonderful, talented panelists.
Awesome. Thank you so much, Lexi. Before I introduce the panelists, let me get into a little bit of housekeeping so this kind of goes smoothly. So basically, I'm going to introduce each panelist and they'll get 3 to 4 minutes to speak before moving into the Q&A portion of the panel. Throughout the panel, viewers are encouraged to share their thoughts in the chat or submit questions through the Q&A button below, which will be collected by our Be a Partner, John. If we have time at the end, we'll ask a few of these questions to our panelists and or the hosts. Also, this is our very first webinar, so if there's any technical difficulties, please bear with us. If truly needed, take out all frustration on the Be a Partner John via the chat. But with that out of the way, our very first panelist is Dr. Marcella Nunez-Smith. She is a Yale Associate Professor of Medicine and Epidemiology, the Director of the Equity Research and Innovation Center at Yale University, among a whole host of other things that I just can't fit. So Dr. Nunez-Smith, would you be able to tell us a little bit more about yourself, your work, and some of these existing disparities that we see in our state?
Thank you so much for that introduction. And it is just a great honor to be here with everyone today. This is, I think, the most important topic that we could be in conversation around. As you mentioned, I'm a practicing internal medicine physician at Yale University, where I also direct a health equity research center. So we've been thinking about these issues for over a decade in that work. And more recently, I've had the privilege of serving as the chair of the community committee on Governor Lamont's Reopen Advisory Task Force. And our committee was really charged with thinking specifically about keeping vulnerable communities safe. If possible, I'd like to just share my screen and just have a few slides to share with the audience today. Okay, just a thumbs up if you can see it. Awesome, great. So everyone here is really familiar. You know, we were maybe shocked or saddened in early April as data emerged from Louisiana, Chicago, and other places in the country showing this disproportionate impact on Black and Brown communities from COVID-19 with really high mortality rates across the country. I had the opportunity, along with my colleague Carrie Gross at Yale, as well as partners at University of Pittsburgh and Tufts, to, in early April, start asking some critical questions about the data we were seeing emerging. You know, were these data complete? Were they accurate? And our first question was, you know, how many states are even reporting COVID-19 mortality by race ethnicity? And at that time, there were only 28 states and New York City who were doing that. And then our question was, of the states that are providing these data, how complete are they? And we held as a standard, if you know you have less than 5% missing data in your death certificates, then we consider that complete. And in early April, there were only 7 states that met that threshold. Connecticut, I will proudly say, was one of the states that was reporting complete data. But as a researcher, you know, my message is always that we need high quality and comprehensive data, particularly around race and ethnicity, if we're going to ever address any inequality sufficiently. And that is most certainly the case for COVID-19. The second question we asked in this article was really, what is the accuracy of the data in terms of the estimates we were seeing emerging? We wanted to know, what if we adjust for age or sort of age match, what would we see? And that's the right part of the slide, where in 22 states plus New York City, we looked at mortality rates for the Black population with a relative risk of almost 4. That's 4 times higher mortality rate for each age stratus, 4 times. And when we looked at Latinx populations, that was almost 2 times. So these disparities are wide. And if we think about the individuals, we often do, that reality is sobering as we think about families and neighborhoods. But I think work that's come out of the Commonwealth Fund and the Kaiser Family Foundation has really reminded us how important place is and that place matters. And so here we see this gap between counties that have a high concentration of sort of Black residents versus counties that have lower concentration of Black residents. And this is separate and regardless of things like SES and income. So even in higher income Black predominant counties, we see this gap. So we have to be thinking both structurally as well as socially in terms of these determinants. This audience knows, you know, I get asked a lot about why we observe COVID-19 disparities, and people are often eager to look to sort of biological differences, but we know that race is not a biological phenomena, that is a social construct. And the contributions to COVID-19 are intergenerational and the result of structural disinvestment for generations in communities of color. And so we are bearing witness to contemporary racial injustice layered on top of what are historical denials of access to opportunity. We have to fight misinformation. I think about this a lot as a public health professional, but also the reality that we've earned distrust in our institutions, and those messages are often heard suspiciously. We have deemed people in low income jobs essential, and they have to put themselves at risk in order to go to work and feed their families. We fail to recognize that social and physical distancing is a privilege, and most people of color do not have that privilege as they are overrepresented in these low-wage essential jobs. And then the realities of living in multi-generational households, often densely populated neighborhoods, on top of what we've heard a lot about, which is the greater burden of coexisting conditions such as heart disease and lung disease. But that again stems from limited access to high quality healthcare, as well as environments that quite frankly have not been safe for things like physical activity. I want to just briefly, just a couple minutes to share with you the results of a poll that my center conducted with the NAACP and the African American Research Collaborative. This was the first national poll of African Americans asking about the impact of COVID-19. And we asked many questions. I only wanted to hold up one today, given our topic of conversation. So we asked the respondents, over 600, how often they were adhering to the public health messages that we continue to push, things like hand washing and staying at least 6 feet away from others, not touching your eyes and mouth. But this last question I want to hone in on, wearing a mask when outside. And we had about 65% of people who said they always do. Unless we get too excited, we really want this dark blue number to be 80% for these messages to be effective. So we wanted to learn more about the question of mask. And so we asked a follow-up question. Do you feel safe wearing a mask in public? Or are you concerned that Black people wearing masks may be misinterpreted as a threat and putting yourself at risk? And I'll draw your eyes here to these two columns that show that among our youngest participants, ages 18 to 49, a full quarter of them felt that they were not safe wearing a mask in public. When we first started talking about these results, people were incredulous. How could that be? And now we fast forward months later, this was an article in Stat that essentially showed that there are many instances where Black men across the country are being stopped by law enforcement and security, being called threatening and seen as a risk to the safety of others, precisely because they're wearing a mask. I mean, one even from Cam Buckner, who's an attorney and a state senator in Illinois, who was stopped as he was shopping in his local a local store in his town. So just, in terms of the call to action that I know you all feel, I hold a personal responsibility, I think, as a physician and a public health professional. We have to have the high quality data. We need to make sure we're doing things like age adjusting it. I will always call for data. When we don't have the data, we keep marginalized populations invisible, and that is a form of oppression. As a physician, I think it's important that my colleagues and I fully understand the dire impacts of racial discrimination in the lives of our patients and our communities, and that we have to think about public health messaging. So, and our recommendations, so mask wearing, for example, and here I also have contact tracing just through an equity lens. But I'll stop there and look forward to the comments from my co-panelists and our discussion.
Thank you so much, Marcella. That presentation was incredibly educational and sobering, as you said. Thanks again. So our next panelist is Solomon James. Solomon is a student at Southern Connecticut State University and one of the lead organizers of the Danbury protests in the wake of the murder of George Floyd. Solomon, would you like to tell us a little bit about yourself and the protests you've organized over the past month?
Can y'all hear me? So,
yes.
Thank you, thank you. Like just stated, I'm Solomon James. I went to school at Southern Connecticut State. I go to school currently for education at Southern Connecticut State University, and I did put together a protest for the death of George Floyd. The biggest things was when I was putting the protest together, I was getting messages up to at one point I had 600 total messages between Twitter DMs, emails, Facebook messages, Snapchat, of people just sharing their stories with me. And my big thing that I was stressing was just because it's not a murder doesn't mean there's not different levels of harassment. So I'm getting things of, I was at the mall with friends and got stopped when I shouldn't. I was just walking down Main Street, and because we're a group of Latino kids, we get stopped and searched and all these other procedures. So my big thing now that I'm doing moving forward from the George Floyd, even though we're still not done with that situation, is just trying to better my community in a way where I'm in conversation with the police chiefs to see rules and procedures, so I can educate my people who that's not like me, that's not willing to step out and be the face of the protest, speak for the people who's nervous or can't speak for themselves. That's what I've been working on lately. Actually, after this, I do have a call with the Danbury police chief and the mayor following up later on this week, just to try to figure out what changes we can make, just so people in my community could feel safer and they could feel like it's not them and us, or it's not I'm just another number within the city, that I'm actually a human being and I have rights and I feel everything that some of my counterparts feel.
Thank you so much, Solomon. And I'm sure that there's so much to learn from your experiences yourself and those that you've been collecting from your community. And hopefully we could pry in a little more into that in the Q&A portion. But our next panelist is Representative Allie-Brennan. He is the General Assembly member representing Bethel, Danbury, Newtown, and Reading. Representative Allie-Brennan, would you tell us a little bit more about yourself and some of the work you do as a General Assembly member related to either COVID-19 or racial justice?
Sure. Thank you guys so much for having me. And hey, Solomon, thanks for all the work you're doing in the Danbury area. So I'm Representative Raghib Allie-Brennan. I represent my hometown of Bethel, where I grew up. I'm from Queens, but we moved here when I was in second grade. And I joke because, I'm openly gay. I'm a person of color. I'm young. My name is a Muslim name. The only thing I'm not is a woman, right? I have all these different minorities that come into a big melting pot, and that's just the one that usually I don't touch upon. But no, it's been awesome. I'm a freshman legislator in the Connecticut State Capitol. I worked in Congress on environmental and energy issues for a congressman from North Carolina and the congressman from New Orleans. My passion has always been environmental justice. And so that's kind of just been where my path has led. But obviously, working in the state capitol, I find myself talking about issues that I didn't think I would be a leader on. And, there's a lot of rooms where I'm the only person that's gay in the room, or the only person that's of color. And, through all this, I've mentioned that, I'm not African-American. I do feel odd sometimes if it's my place to speak on some of these issues. And I think the worst thing you can do is not speak up. I'm West Indian. My dad's Guyanese, is an immigrant. My mom's Irish. I understand I have privilege, and but I'm the only openly gay legislator in Connecticut. Only one of two openly in the state capitol. So there's a lot of different things that I still witness, and my experience, has been eye-opening as well. But I serve with Representative Reyes, who, it's an honor to be in the Black and Puerto Rican Caucus together and fight on those issues. But I'll leave it there and we can talk more.
Awesome. Thank you so much, Representative. And with that, our last panelist is Representative Geraldo Reyes. Representative Reyes is the General Assembly member from the 75th District in Waterbury, and also serves as the co-chair of Connecticut's Black and Puerto Rican Caucus. Representative, would you like to tell us a little bit more about yourself and some of the work you either do in the legislature or your caucus?
Well, thank you very much, and good afternoon to everybody, and thank you for having me. And it's an honor and privilege to be serving in the great city of Waterbury. I'm one of 5 state legislators in Waterbury. Waterbury is a little bit different than a lot of other cities where it's not predominantly dominated by one party or another. We actually have 3 Democrats and 2 Republicans serving in the House, and 1 Democrat and 1 Republican serving in the Senate. So it's not your typical city where it's all dominated by one party. I can tell you that I'll be finishing up my 5th year this year, and if I'm fortunate to get re-elected in November, I'll be starting my 4th term. And it's amazing how fast things are moving. And by trade, going into politics was not my ideal. I was basically running campaigns for other politicians, and the local board of education, local board of alderman races that got involved all on the local level, strictly in the management side. And then one day, one of our candidates got in trouble, and we really didn't have a person to go. And by virtue of somebody got me on the shoulder, says, "You're looking too hard, you're it." And we need to work hard. And that's the beginning of that chapter. And I've been up there for 5 years. I have the person serving on appropriations, transportation, environmental, commerce, and it's a heavy lift. And I have the privilege of serving on the Progressive and Black and Puerto Rican Caucus, which I think are two dynamic and very forthcoming and seeking truth and speaking truth to power type of organizations, and that's why I'm there. We one of the things I want to talk about was what COVID-19 has definitely brought out, and Nunez-Smith has pointed it out very nicely. COVID-19 has really showed the inequality and the equity pieces and how it's really out of balance, and that although COVID-19 didn't separate one from the other, or you didn't have any prejudice one way or the other, everybody was affected equally. But how everybody is coming out of it, how everybody transferred through it, how everybody negotiated day by day, and which group was more able to stay home and work from a computer, and which group was really out on the front line day in, day out. And these numbers are staggering. And I can't wait to dive into the conversation, because COVID-19 really showed the imbalance of what this our city, state, and nation really looks like. And lastly, I mentioned that the one of the bills that's also a priority bill for Black and Puerto Rican Caucus is environmental justice. And coming from the manufacturing world, I know what pollution looks and smells like, and what's right and wrong from a manufacturing operation standpoint. And now I'm wearing a different hat, and I'm sitting up in Hartford, and I have an opportunity to dive and change policies so that communities like mine don't continue to get polluted. So pleased to be here, and looking forward to the conversation.
Thank you so much, Representative. At this point, I will pass it back to Lexi, who will dive into the Q&A portion of the panel.
Yeah, thank you so much again, Farian. And I just want to say thank you to all of our panelists again for being here. Your insights are so important right now, probably more important than almost ever in my lifetime. So I'm very grateful to get to talk to you about all of this. Now that we've gotten into your backgrounds, we're just going to transition to a Q&A. But first, I'll go over a little bit more logistical stuff and some context. So I'm going to be posing 3 to 4 questions depending on how we're looking on time. But they'll all address the relationship between COVID-19 and racial justice. And basically what we did was we gathered information from our friends, our community members, and other people. And we had them ask us their most pressing questions. And using those, we put together these questions as a way to respond and to push the conversation forward and inspire each other and ourselves to act at this time. So while some of the questions may be specific to a certain field or a certain topic, we really do want to hear about it from everybody's perspective. So I might, for example, address the question in the beginning to somebody, but I would love if you can respond to each other and build off of what another person is saying. And I'll be here to facilitate in case there's any sort of problems with that. But to dive in, the first question that we're gonna talk about is, as we see protests continue around the country, the spotlight is on racial justice. What relationship do you each see between the COVID-19 pandemic and racial inequalities, and how do you personally see them as being intertwined? And I was wondering if Dr. Nunez-Smith, you could start us off first.
Yeah, thanks, Lexi. And I too am looking forward to hearing the co-panelists respond to that. And I think it's a great question. To me, they are incredibly intertwined and cannot be teased apart. I think what we see is that there has been this very deliberate, very systematic denial of access to resources for people of color in our country for generations. And so whether that then gets manifest as disparities in health, right? And so we see that with COVID-19 because the disparities across the continuum of, ability to get tested, ability to access care, utilization of intensive care services, and of course, mortality. But it's the same denial of access to opportunity and the injustice, right, that underscores that. That is at the core. I think of this. This is all the expression of racial violence, right? Whether we see it in health or we see it manifested in police brutality. And reporters will often ask me, shouldn't people be home because it's COVID-19, and shouldn't the protesters get off the street? And I said, no, they shouldn't get off the street, right? We should protest safely. And it is our job to give the right public health messages to how to protest safely. But everyone is protesting for access to opportunity. And I think, that is important right now more than ever.
Yeah, absolutely. Thank you so much. Solomon, I would actually love to hear from you about on the ground how you and your peers, other people feel maybe like the influence of the pandemic on the protesters, their motivations, anything like that.
So, all right, there's 3 different groups. The first group is the people protesting that supports it. Being on the ground and organizing the protests, a lot of the things I was doing is getting advice from different people that deals with health, different nurses and whatnot that deals with Corona directly. Because I have a bunch of friends who moms work in the hospital and take suggestions for them. They told me, one of the things they told me was, if you can, make sure you stress everyone should be wearing a mask. Even though the 6 feet apart thing was hard to keep, even though I did try to keep distant, it was a hard thing to control. We had, at our protest, we had close to 4,000 people. It was hard for us to keep the distance from everyone. We were walking on the street, but we did stress, like, please wear a mask. If you have a mask, we gave out a few masks. We had 150 donated. Another thing was, please don't share beverages with each other outside. Friends shouldn't share beverages, even though it was a hot day and people were thirsty. Luckily, we had donations for that. So people had their own little water bottles, and we had people on the street handing out water bottles. Another thing was the group that says, well, everyone should stay at home. For a lot of people, especially in the low income family, that's not an option. They have to go to work. They have bills to pay. Like, one thing that I know is I came back from school because Corona, everyone left school. I think it was like 2 or 3 months early. I don't remember exactly. Yeah, 2 months early. A lot of the people that I've seen, like some of my friends' moms, some of the people in my community, Corona hit and they were still having to go to work. Even with the stimulus check, even with some people being on unemployment, some people had no choice to work because they have maybe 3 kids at home. They have to make sure that this bill is paid or that bill are paid. Some people that's just got out of incarceration that I know of and shared their story with me, part of the way they stay in the halfway hours, they have to maintain a job. So they couldn't collect unemployment. So like things like that, people don't put in consideration when they say, well, stay at home. Well, some people who doesn't have 6 months or 3 months of savings because they live paycheck to paycheck, can't really do things like that. So that's my perspective on it. The coronavirus, the good thing that came out of it was that it got a lot of people out, because there is people who's unemployed. There is people who's out, a lot of students out of school. So when you do see these protests, there's no reason, unless you do have health issues, which I don't advise you if you do have severe health issues or if you're more older, to go out there. But you can support in other ways by sharing information via social media or via conversation with people. So that's one of the big things, I have to say. The numbers that people coming out is up there, and that's one of the good things that came out of Corona. And I say that with quotations because it is a virus, and people is getting sick, and people are dying. But it also helped us be able to show togetherness and showing support. And like one of my coaches always told me, like, there is strength in numbers, like, and pressure. Like if there's one person, maybe a government official or police chief I could brush you off. 2 people I could brush off. If hundreds and thousands, you can't brush off 1,000 people with the same message and ideology that's aimed for the same thing. So that's my view on it.
Yeah, thank you so much. Absolutely. That was super important. so good to hear stories from people that we don't usually. Next, either of the representatives, did either of you have anything that you wanted to add immediately or?
Sure, I'll go.
Yeah, absolutely. Thank you.
Yeah, well, I mean, I don't mean to get political, but I mean, I guess that's why we're here. But I guess,
Totally.
The relationship, I see between COVID-19 and, the racial justice movements is really the, ineptitude of our leadership, is how I put it best. Issues of racial justice didn't start because of COVID, though the crisis has intensified long-held issues of equity and justice. But many of the causes of the current administration's, epic mishandling of the pandemic are relevant to the current state of racial affairs. And to a degree, some of the inequities related to race in healthcare have been amplified by this health crisis. But honestly, it's the ineptitude of the response to COVID, that's required the president to pivot to issues that will garner support within his base. And his failed response and inability to manage a crisis related to racial justice has fanned the flames and brought the anger and frustration, of Americans to the forefront. So, I really do see that connection here being just the ineptitude of our current leadership.
Yeah, that was beautifully said for something as depressing as what's going on. Representative Reyes, did you want to add something?
Thank you very much for the opportunity. So Waterbury, being the 5th largest city in the state of Connecticut, was number 2 in deaths from COVID-19 with 189, second only to Stanford. And the largest percentage of that is related to nursing homes. So I think in Waterbury, more so I can speak about Waterbury and the protests and rallies I've been to, I really have to say that most of the people have been really very cautious. There have been a lot of folks wearing masks. Every rally that I go to, every protest that I go to, I have a pocket full of masks to hand out. And I usually hand out 4 or 5. But I have to honestly say, more often than not, the protesters have been in Waterbury. Anyway, I can speak about Waterbury and the greater Waterbury area that I've been to some of these rallies. They're being very safe. Yes, as Solomon pointed out, the 6-foot rule is kind of out the window when you're shoulder to shoulder and you're listening to a speaker up on top of a monument or something. But people are at least somewhat aware, and I think in Waterbury it's because of the fact we've had such a high profile number of deaths and especially in the nursing homes. So I noticed that a lot of the protests and rallies are typically younger people. I'll be very honest and truthful. I have not gone on any highway to block any cars. I personally have not done it, but I've been in rallies that have been walking all around the city. And for the most part, they've been pretty safe. And also police, either police led or with police monitoring, if you will, the situation. But people have every right to protest. It's one of our given rights here in this country. And thank God that nobody is stifling anybody's voice. And I think as long as we do it responsibly, and again, being a little older than this particular crowd, I am not for knocking down statues by hook or by crook. I think that if they're going to come down, they should come down justifiably by the way let the municipalities or the states take down. But I don't believe that we should do anything forcibly. And I think another wrong doesn't correct a wrong. Let's do it right. But everybody should protest, and everybody should have the ability to protest safely.
Yeah, thank you so much. That actually brings us directly to our next question, which is related to this same thing. I really appreciate all of those insights. It's great to hear from all of you. And the next question is, keeping people safe is paramount to maintaining protest movements across the country, obviously. So what measures, other than, as we talked about, wearing masks and doing our best to maintain social distancing, can protesters take to keep themselves and their communities as safe as possible from COVID-19? Because like we said, it is a lot of younger people protesting. So while they may not run a risk themselves necessarily, we do really want to make sure that we're keeping the whole community safe, the people that they're going back to at home. And then a second part of this question, which is that protesting is an unalienable right. So how can we as community leaders or policymakers ensure that this right be upheld while, again, still promoting health and safety of people? And we touched on this a little bit, but if there's anything that anybody wants to add. Perhaps I can pick on Dr. Nunez-Smith again to see if you can give us any recommendations other than mask wearing and social distancing.
Yeah, absolutely. So I'm happy to start, especially with part A of the question, right? So
gladly, thank you.
Yeah. So I'm saying, how do we protest safely? So, it is important, the masking, and I continue to say the recommendation is for a mask. It's important to understand what kind of mask, if you'll indulge me. I will say that the kind of mask does matter. So we are talking about cloth face coverings. I will encourage everybody to have a cloth face covering that is double, if possible, triple layer of a tight woven cotton. It matters. If you can get a filter pocket in there, even better, right? What goes in the filter pocket, what I use literally is an unscented dryer sheet folded over so that it creates sort of 4 more layers in that filter, right? Get a mask that is, or a face covering that is tight to your face if you can. So it does matter. I know I see a lot of bandanas and that's not what I would recommend, and that's not what the CDC would recommend. So the kind of mask does matter. The surgical mask too is also fine, but again, the cloth face covering, 3 layers. So masking important. What Solomon said, couldn't agree more. No sharing of food, no sharing of drink. Keep your stocks to yourself. Really important. And then to this question of keeping folks safe. So when you come home, have a space to take those clothes off. This is what we do also for in the hospital, right? We come home, take those clothes outside, right? We put them in a bag, literally, and bring that Ziploc bag right to the washing machine and dump the clothes in the hottest water possible, right? And then make sure you wash that mask too. Take out that filter, whatever you've put in as a filter, throw that away. Wash the mask. You have to, and wait for that to dry fully before you use it. And then the symptom checklist is really important. I know it's hard to isolate at home. I mean, that's what we would recommend, really, is staying apart from high-risk folks in your household for at least 5 to 7 days after that exposure. But no matter what you're doing, take your symptom check twice a day after you've been at a protest. Check your temperature and be making sure that you don't have any of the symptoms that we look for, things like cough or shortness of breath. And then seek help. But they take these measures, and really that abundance of caution, you can protest safely.
Thank you so much. Yeah, that was so helpful. And then to speak to the second half of the question, maybe to hear from either you, Solomon, or again, either of the representatives about how we can really, enforce this information, make sure that this right is being upheld and people are allowed to go out and protest, but also, just stressing the critical importance of health and safety right now.
I like to jump in here and just speak about an observation that I've made at several of the protests I've been to, and it speaks to leadership from the nation's president. Because he doesn't wear a mask, I've noticed that a lot of law enforcement also does not want to wear a mask, and I brought this up to the chief of police in my city, Chief Spagnola, who wears a mask. 80% of his rank and file do not, and these are the men that are out there in front of the protesters and around the protesters. And I think that if you're going to really stress safety, it starts with leadership. And I've asked the chief of police once again to please have his men wear the mask, especially if they're at protests. And the reason I say this is because already half a dozen men in the police department have already tested positive for COVID. So I know that they're doing their due diligence with the quarantine and separating, contact tracing. I know they're doing all that, but as a taxpayer and as a person that knows a little bit more than person A, I would say that I would feel better and safer in a protest and rally if all the policemen also have masks.
Yeah, I'm so glad to hear you bring that up. I think that that's the perfect thing that we need to be talking about, because that needs to come from all levels, from the scientific level to you, from the community level, and something that I noticed as well here in New York City. Does anybody else have anything that they immediately would like to add?
I'd like to touch on the first part.
Yeah.
Like Doctor said, that was one of the things I stressed. I told everyone once we got back from our protest and we to our in meeting space, I told them, I was like, if possible, please wash your clothes like right away. Don't throw it in a laundry basket with the rest of your clothes. If you do live with, because they're out of 4,000 people, I will assume that some of them probably do live with elderly people. Please don't go right in contact without showering and washing your body and washing your hands and face. So I was so cautious about like making sure they had the right information, just so it could avoid so many other things that's compiled onto it. I know when I got home, it was like I walked through the front door and we have like a mud room, like for your shoes and stuff, and it was just like clothes off. Let's go wash these right away alone, just so if it does stick to clothes, it doesn't contaminate anything else that I have, or it doesn't brush against a wall or a hand railing that we have in our house or the doorknob. Hand sanitizer too, I'm big on that. Like I keep the double pump, the pump bottles, because like people sometimes don't realize how many things they actually come in contact with on a daily, from doorknobs to door handles to car doors to like if you go shopping, even though some shopping markets do wipe down thing, it doesn't mean it's thoroughly clean. It's not thoroughly clean. So there could be still some germs on that. In the aisles, people touch boxes, look at them and put them back. So if you do it, you could only imagine how many other people have done the same thing without buying it. So I'm big on like keeping hand sanitizer on them, disinfectant wipes if you have that as well.
And 20 seconds for the hand sanitizer. If I just could echo, I'm nodding so vigorously because everybody's making these really excellent points. But, it's the same like hand washing. So 20 seconds when you do the double pump, it's still 20, it's got to be 20 seconds that you're kind of doing the motion and rubbing. So make sure you do that too.
I'll definitely pass that message on, because I didn't know. I personally did. I just thought it's the
20 seconds, the same 20-second rule. Sing happy birthday.
Okay. I'll definitely make sure I pass that message on.
Tips and tricks.
And I'll just add, obviously if there's testing widespread and available in your area, I know we have in Danbury, please, go ahead and why not do that after or before or both, and, also like Solomon touched upon, you don't really have to go to a march to be part of this movement. Everyone has a platform, we have social media, you're reaching people and maybe even more directly than you would at a march. So, that's also an acceptable way of being part of this. And, I'll add that, I'm a person of color and I represent, more of the suburban part of Connecticut. I do have Danbury, but majority of my district's like nearly 80% white. And so, I think this is an uncomfortable conversation for a lot of people to have. And I think, sometimes we've seen some mistakes by leadership in towns to not have the conversation or to use the fear of COVID to kind of, stifle the conversation and the movement. And I think that's where you make the big mistake of having certain groups come in that are angry. I was planning a vigil, for George Floyd and all those we've lost to police brutality, and got canceled last minute because of the safety issues. But I think it's safer when we have leadership of a town, doing it with police side by side in a orderly fashion. So obviously there's going to be angry people and conversations that people don't want to have, but it's time to have it. So that's where I'll leave it.
Yeah, great. Thank you so much, all of you. Again, I'm going to be saying that a lot if you haven't noticed. All right. So moving on to our next question. This one, again, it touches on stuff that we've already talked about, but I would love to dive deeper into. So as noted, COVID-19 is hitting Black and Brown communities the hardest. This disproportionate effect is seen in both health and economic disparities. However, this is not a new phenomenon. Can each of you speak to how this pandemic has exacerbated these previously existing issues, what you've noticed, what you picked up on the ways that it does it? If Solomon, I was actually thinking this would be really interesting from your perspective as another young person and as a community organizer, just because this is something I feel like it's interesting that we've kind of grown up in this in a lot of ways as young people. Like we've seen this our whole lives and we've seen these changes in kind of like a really urgent manner. So if you want to talk about that, I would be grateful.
Well, so from, like I said, talking to a bunch of people through DMs and everything like that and emails, some people, especially younger ages, kids that's working now at restaurants or CNAs and other things like that, a lot of them says like, the reason why I don't get tested, or I won't get tested, is because I can't lose this money. Like I need, like I help, like I, even though I do live with my mom and dad, my dad has this disability, or my mom's unemployed, so I'm the breadwinner in my family. So a lot of younger people don't want to get tested, because they get tested, that means they miss out on work. They miss out on work, that means they get behind on, even though there's relief programs and stuff like that that I'm conscious of, that they're conscious of at least, they just don't want to risk it. A lot of it is a fear factor too. A lot of people don't want to go through the whole nasal swab or mouth swab, however they administer the test, because some people have bad experience in the hospital already that they have dealt with, or doctor's office, where they're not getting they're getting misinformation, or not getting full information, or just the way they're treated just because of their skin color. Or sometimes a lot of the Islamic Muslim people who have hit me up and has been talking to me has said the way they've been treated, it's discouraged them to go back. And if they don't feel like they don't have the full symptoms, or they feel healthy enough to keep going, most of them do keep going. And I understand that, but at the same time, it scares me sometimes, because it's like, it's not that you're putting me at a risk, because younger people do have a stronger survival rate. It's you're putting grandparents and parents at risk that you indirectly might come in contact with. So on one end, at one end, you can see the issue with our medical system, and how sometimes they just trying to, all right, you need to go. Like, all right, this is go. And you see it a lot of times with other things, not just through COVID, but other things, whether they go in because they have a headache, or they're going because they have this issue or that issue. And some people don't have insurance to get these checkups. So like their experience with, how do I actually go through this COVID process, and some people don't have the actual knowledge of, how do I do this? So I think one thing that's good about the internet is younger people is equipping actually the older generation with information of, all right, so this is how you sign up. This is how you get the test. You get the test back forward. I think it's 4 days after you take the test. I'm pretty sure. Don't quote me on that though. So younger people is using the information they're getting from Twitter, and they're getting information that they're seeing online, because we're the web surfers. We're the ones most online, and we see the most information internet wise. So we're basically equipping the older generation who normally might not know how to deal with certain things like this.
Yeah, thank you so much. Absolutely. Those were so many good points. Rep Reyes, did you want to add something next?
I did. Thank you very much.
Yeah, of course.
For the city of Waterbury, again, I keep going back to, it's the 5th largest city in the state of Connecticut. And at first, when there were limited number of COVID testing available, and it was new, it was a chaos, and nobody really knew what was going on. There were clear communication problems, even with those people that were informed. If you can trickle that down to some of the groups that are usually informed, or have no, or have language barrier, it just got worse. And then that went on for maybe 3 weeks, 4 weeks, 5 weeks. Only going to this drive-in to get COVID testing if you had a doctor's prescription and you were sent to either Waterbury Hospital or St. Mary's Hospital, and that left out a whole lot of people that didn't even have insurance, and or didn't have the understanding that you need to go to the doctor, even if they had the insurance. And it didn't sit right with me and the legislators in Waterbury. And we campaigned and fought hard to get testing for everybody, which is what we finally ended up with here. We went from no testing sites to 2, and then we went to 4 that are open daily, no questions asked, for communities of color, the undocumented population, and those that are underinsured or uninsured or have no insurance at all. So I think that this pointed out, again, a huge imbalance in inequity when it came to the insurance part of it. And the last point I'll make is even the folks that are testing for COVID on a daily basis, and I share everything I'm sharing with you guys right now, they've not done a great job of outreach going into those communities and telling the people, hey, come to the location A at such time and you'll get tested free. That piece is important, and it needs to be said in the language of these communities. In Waterbury, we have English, Spanish, and Albanian, large Albanian population, and we've done that. We finally got it in their language, and the testing is picking up. But I was really bothered by the fact that communities of color were not involved in the original swing of testing, considering the African Americans and Hispanics were testing higher with COVID and dying at a higher rate than anybody else. So that's why I was really upset about the whole thing. But we finally got it swung around. Thank you.
Yeah, thank you so much for that and for all the work you've been doing in the community. It's so great. Does anybody else want to add something right now immediately, or?
Yeah, I mean, I will add, I mean, I guess just thinking about the whole pandemic, you know, I think people forget, you know, like it's uncomfortable for some of us. You know, I'm lucky. I live alone. You know, obviously it was pretty lonely throughout the first portion of it, but, you know, I'm very lucky. You have to remember the families that there's so many families across the state that they live in small homes and there's so many of them. You know, imagine catching, you know, COVID-19 and having to self-quarantine in a house where it's almost impossible. And let alone, you know, our healthcare system has systemic flaws. And so this has only exacerbated that whole system. And think about the undocumented community, you know, who's afraid to go to the hospital or has no access to healthcare, who have to take transportation to get to the hospital. It's just, you know, I know friends my age that don't even have a primary care doctor. So, you know, who would rather stick out the sickness than go to the doctor and pay for it. So you just have to think about how much that's just been worsened. And, you know, my heart does go out to the undocumented community in the state and across the country. You know, I worked along with a group of volunteers during the pandemic to help make sure that we can send food and resources to local food banks in Danbury area, just, you know, focus on communities of color and the undocumented community, because they really have no lifeline at all. And so, you know, I'm looking forward, you know, I know the governor has done some policy to help out, but looking forward to going to General Assembly to see how much we can help out more of Connecticut. And, but yeah, I just think people have to think, you know, you think you have a heart, but just imagine, you know, taking the risks to get on the public transportation to go to the hospital for something you can't afford. And, you know, like Representative Reyes said earlier, you know, things have shifted to telework. Some people are so blessed to be able to work from home. Some people can't work at home. You know, they have to go to the grocery store and work right in the middle of the pandemic. So it's not as easy as people think it is. We've all been inconvenienced, but it's just so much harder for so many others.
Yeah, absolutely. Yeah, thank you. Just Dr. Nunez-Smith, did you want to add anything? If not, we can move on to the next question.
All very well said. We can
awesome.
move on.
Perfect. Thank you so much. So just one more thing. This one is very, very important though. So we're going to be talking about science again, but the question is, how can we effectively apply the science and the research that we have about COVID-19 to the racial justice movement from an organizing or a policymaking perspective? And can you all explain how organizers and policymakers can use what we already know about COVID-19 to keep our community safe and healthy? So yeah, I will probably just pick on you again one more time, Marcella. Thank you so much for being patient with me.
No, of course. I mean, these are great questions. And
yeah.
So I think we do know, I mean, this is an ever evolving landscape. I want to be really clear about that. I mean, even as physicians, we're learning a lot about COVID-19 as we go. And so we've even expanded our understanding of how this can present, right? It's not just a respiratory illness, it affects all systems. We see young people presenting with massive stroke, for example. We see older people presenting with just sort of fatigue and confusion. So we're learning about it, but I agree that there is science and evidence that we can apply, so, I'm very, firm on this notion of the public health message that is culturally responsive. And we have to think about the message as well as the messenger. And so, I think community health workers and sort of people of community to community and with community is the way to go. And so as a sort of policy and strategy, I think we can lean way more into that. I mean, and in addition to everything else that was said, I mean, we have to make sure that as we recommend to people self-quarantine and self-isolation, that there aren't existing incentives that work against them wanting to adhere to that, whether that be economic or not having access to housing or food. So to me, I think we already do know the science, the evidence of what we need to do policy-wise. I too am very grateful to everybody else on this panel for the leadership and hard work already that they're doing. But you're right. I mean, we can act now, and we should.
Yeah, absolutely. On that, is there anything anyone has to say about that immediately? I think that this is a super important thing, because you're right. While we do have a lot of the information, there are these, barriers that you have to get around. The thing is, we can tell people to stay at home as much as we want, but until we make it actually possible for them to do that in, various different ways across different landscapes, then it's impossible, and we're screaming into the void. So I'm glad we're here to talk about how we can really make that possible. And I would love to hear from someone else.
I think Solomon had his.
Yeah.
Great, thank you.
So, like just stated, that's one big thing is like initiatives of like, all right, if you want us to stay in, you want to see things go down, you want to see Corona die out. What is the reason to stay home? How are you going to keep people who's essential workers or workers at all in the house? What are you going to do to motivate people to stay in? Because it's hard to tell someone you need to stay in your house, yet they don't have food. Pantries are I know in some areas, pantries are dry, empty. There's some food pantries, there's no food left in the pantries. So you're telling me to stay in the house, yet I can't eat every day. So you need to figure out a way. I think we need to figure out ways to balance. Okay, we want you to stay in the house as a government, as medical professionals, but we also have to figure out how do we get it so people is actually physically and healthy as well possible for people to stay in the house. So once we figure that out, then I think it will be more possible. But until then, I think you're going to keep seeing the same trends and the same behaviors because people just don't have the tools to actually stay in their house.
Whoops, sorry. Got knocked down. I saw that Representative Reyes, you raised your hand. Thank you so much, Solomon, for that. Did you want to add something on, Representative?
Yep, thank you, Lexi. Yes, I wanted to piggyback off of what Solomon was saying and share my experiences here in the city of Waterbury. So two extremes, the young and the elderly. So with the young, especially with the school-age kids, the city of Waterbury has provided lunch and breakfast for all students to be picked up at 22 of the 32 schools we have in the city. And one family member can come and get it for everybody. You don't need to be present, and it doesn't even have to be a family member as long as one person comes. And since this whole thing started, the city of Waterbury has handed out over 500,000 breakfast and/or lunch to the young. And as far as the seniors, the nonprofits, what they've done is because most of the the nonprofits that run the day operations for the seniors have been canceled or postponed indefinitely. These folks are getting their lunch and dinner sent to them by these same services. So as long as you are registered as a pupil, as a student, and/or in one of these programs with the nonprofits, the food part of it has been taken care of, and that's one of the programs, a couple of the programs that I'm very happy and proud to have been part of here in the city of Waterbury. But to Solomon's point, those now that don't fall in either one of those, and there's the working population and/or maybe you're home disabled. And the other thing I would say, I think that Governor Lamanna in the state of Connecticut did get some of the labor situations. I think other than the labor department itself just couldn't handle the mass sheer volume of what hit it with an antiquated system. But most of the people were accommodated either through the Department of Labor, some sort of unemployment assistance, and/or combination with rent and/or mortgage assistance. So, every little thing adds up to help keep you home if you can stay home. And I think Connecticut and Rhode Island and New York were some of the states that actually got it right. And when they do something right, I like to say it.
Yeah, I'm all about the positivity, especially now we need it more than ever.
I'll jump in quick.
Yeah, please.
Yeah, and so I guess I'll also touch upon, just the misinformation. It's our job as policymakers, especially, I mean, one of the saddest parts of my job was having to put out a post about the pandemic video that was circulating. I saw friends and family that I knew were smarter than that sharing it. And, obviously at a time where we're scared and we want to blame people, it's easy to kind of fall into some of those traps. And so, I had to take the time to here's resources to tell you why these, these are not truths. These are, this is fake. And it's disappointing, but I think it's our job to make sure that we're trying to push it back against all the misinformation, and just that we're sharing the facts, not our opinion. Here's what's going on in the state. And for me as a representative from the beginning, I've been trying to just kind of not dumb it down, but make it, because sometimes I get confused, what does this even mean? So making sure that, you're not just sending, here's a link and here's what's happening, good luck. I try to break it down and make sure that people can really get that information and spread it. So that's been helpful, I know, but I mean, just for Representative Reyes and I, it's just taking the facts and making sure that we're disseminating it appropriately. And yeah, I mean, just having the conversations with the community. I visited some nursing homes in the area as well, and just hearing the real truths, not what people want you to believe is going on. So, and we take that back, and we're going to a special session this summer, and we're going to make sure that we do what's right by the people of Connecticut. So,
yeah, thank you. I think you illustrate a really interesting point about how kind of fear has manifested in many different ways during this, something that we kind of talked about over the course of this, I think from a few different angles, which is super important. And then I'm just gonna, now that we're done with that, thank you all one more time, and then pass it over to Farian. We might have time for a question from the audience. Let me just.
So it looks like we are a little bit over. So to the few audience members who did submit us questions, I will take your questions and distribute them to the panelists and then get back to you individually with answers. Hopefully that is sufficient. I'm so sorry we ran over time, but Lexi, do you just want to close this out?
Yeah, of course. So just kind of to close it out, we just want to say that, as COVID cases rise and we continue to fight the pandemic, how we address these racial inequalities will really continue to be an important issue when it comes to, maintaining the health and well-being of our entire community, which we, cannot stress the importance of right now. And I know this can be really disheartening, really grim, and kind of honestly, in some ways, discouraging to talk about. But it's really conversations like these and, opening up dialogue in ways like this that does allow us to spread hope and create these kind of wholesome solutions to the problems. And that's what we need to do. So on that note, I want to thank you all again for engaging in this discussion. I want to thank all of the attendees for being here, everyone for listening to this, taking the time. Hopefully you also continue to apply it in the future at all times. And then just want to thank our sponsor, 4.0 Schools. So 4.0 provides coaching, curriculums, and cash to foster more equitable futures. And they recently granted us with a 6-month fellowship to help us to develop educational tools to support Connecticut students. So we're going to help them make responsible, safe decisions to help their community in the fall. And then as for being a part of Be A Part, there are several ways that you can support us. But for now, we have one thing that we're going to ask you to do before you go. So if you can open up a tab and go to our website, it is www.beapart.org. And then John will also be posting the URL in the chat. I just saw it go up, so you can click there if that's easier for you. I'll give everyone a second to go ahead and do that. And then once you get there, if you can scroll down, there will be a kind of banner with a blue background. And I would like it if you could enter your name quickly, your zip code, your phone number, and then your email. And then that way we will be sending out a survey with some next steps, some information about everything that we talked about in the panel, and some new initiatives that you can take part in going forward. So I'll give you all some more time to do that. But we're very excited to host more events like this one. We have a bunch of projects that are in the works in the beginning stages. So just keep following us to stay updated on that. We'll let you all know when you can join us again. And then one more thing to close out, I just want to ask that all of the panelists really quickly unmute, kind of thank each other and say goodbye, just so that we can
Yeah, thank you so much for having us.
all connect again. Yeah, thank you so much. It was so lovely to hear from all of you.
Thank you very much for the opportunity, folks.
This was
Thank you.
Yes,
Discussion.
thank you.
You guys.
Thank you.
Get your flu shots this year.
Yes, good plug.
Thanks, guys.
And get COVID tested.
And tested.
Oh, no.
Thank you.
Thank you.
Protest safely.